A 53-year-old man with chronic heart failure develops a red, swollen, and acutely tender right large toe. He is subsequently diagnosed with a gout and started on a new medication. A few days later, his symptoms of gout have significantly improved. However, he is now short of breath and complaining of orthopnea. What is the likely medication that he was started on? A. Prednisolone. B. Paracetamol. C. Ibuprofen. D. Colchicine. E. Beta blockers. And the answer will be ibuprofen. And we will explain why it's ibuprofen. Okay, explanation. Non-steroidal anti-inflammatory drugs or NSAIDs should be avoided in patients with chronic kidney disease, heart failure, or ischemic heart disease. And ibuprofen is non-steroidal anti-inflammatory drug. Selective COX-2 inhibitors should also be avoided in these patients. Which patients? Patients with heart disease, ischemic heart disease, heart failure, and chronic kidney disease. And why? Why we should avoid NSAIDs in these patients? NSAIDs inhibit the synthesis of prostaglandins, and this in turn can lead to a reduction in sodium exertion, renal perfusion, and glomerular filtration rate. They can also reduce the effectiveness and increase the toxicity of ACE inhibitors and diuretics. This can result in an exacerbation of heart failure. That's why the patient had shortness of breath and orthopnea. NSAIDs can cause the kidney to retain more salt and water in the body, which can increase the risk of heart failure. They can also make some blood pressure lowering medicines such as ACE inhibitors and diuretics less effective, as we explained above. And a rise in blood pressure is likely to worsen heart failure. And it's clear when the effect of ACE inhibitors is decreased, and we can see the side effect on heart failure patients, on patients with heart failure. And it's also worth noting that thiazide diuretics increase the risk of gout due to reduced clearance of uric acid. And this is a very important note also when you are prescribing thiazide diuretics for patients with gout, and we must consider this point.